Have you ever paused to consider how artificial intelligence could truly reshape your healthcare experience?
It's a big question, isn't it?
Absolutely. We're talking incredible potential here. Diagnostics getting way more precise, treatments becoming super personalized.
Right.
But what if this amazing future has a hidden catch, a
Okay.
sort of unseen vulnerability?
It definitely does. And it's something critical we call health data poverty.
Healthy data poverty. Okay, tell us more.
Yeah, it's not just about lacking access to doctors. It's uh, the inability for people, sometimes whole groups, to actually benefit from new discoveries.
Why? Because the data behind it all isn't representative.
Exactly, because it doesn't adequately reflect them. And today we're going to dive deep into how this data issue can, well, unintentionally make existing health disparities even worse.
So this hidden flaw, health data poverty, what does it really mean for you listening right now? And I guess for the future of health equity?
That's the core question.
That's our mission today then. Let's try and uncover these biases hidden in the data, hidden in the AI. Okay. So first, let's talk about the promise. AI in healthcare. It could be revolutionary, right? Moving us away from maybe anecdotal stuff towards really evidence-based care.
Precisely. Think about improved efficiency, better predictions, radiology, genetic risk, all sorts of things.
But there's a problem.
There's the core challenge, yeah.
Let's see.
AI, machine learning, they're only ever as good as the data they learn from.
Right. People often think computers are objective, just logic.
It's a common misconception. But really, AI is like a mirror. And if the data it reflects is flawed or incomplete or biased,
It doesn't just show the flaws, it makes them bigger.
it can actually amplify them, turn small data issues into, well, significant health disparities down the line.
Wow.
And the research we looked at really backs this up. A big review found studies kept hitting on health disparities, something like 72% of them. And AI bias specifically, that came up in 28%.
And bias in the input data.
Yeah, that was flagged in about 18% of the studies, too. It's a recurring theme.
Okay, let's make this concrete. Can you give some examples, ones that really sort of bring this home?
Sure. Think about dermatology. If training data sets mostly have images of lighter skin,
Then diagnosing conditions on darker skin becomes harder.
exactly, it can lead to underdiagnosis, potentially delayed treatment for serious conditions.
That's worrying. What else?
Pulse oximeters, those little fingertip devices, they can sometimes overestimate oxygen levels in people with darker skin.
Which could lead to different treatment decisions, maybe less intervention when it's needed.
Potentially, yes. And there are risk assessment tools, like the famous Framingham Risk Score for heart disease.
Right, I've heard of that.
Well, studies showed it predicted cardiovascular risk about 20% lower for Black individuals compared to white individuals.
Not because the risk is actually lower, but because the tool isn't capturing their risk factors properly.
That seems to be the issue, yeah. It suggests an inadequate capture for certain groups. And even genetic data. It often lacks representation from minority populations. Think African, Polynesian, Brazilian genomes.
Which limits access to personalized medicine for those groups.
Directly limits it. So you see, this bias isn't just one thing. It can creep in anywhere.
Where, exactly? Like, in the process.
Well, you can think of three main stages. First, the data itself. Is it missing people? Is it unrepresentative from the start?
Okay, stage one, bad data in it.
Then second, the model. How the algorithm is designed. Even small biases in the data can get magnified here.
All right.
And third, implementation. How is the tool actually used in a clinic? Unforeseen interactions. How doctors interpret the results that can introduce bias too.
Data, model, implementation. It can go wrong at any step. These examples are pretty stark. So what's the biggest lever we can pull here? What can actually be done?
Well, several key things came out of the research. First, just awareness. Understanding that these AI tools have limitations. They can be like black boxes.
Hard to see inside, hard to know why it gave that result.
Exactly, which makes hidden bias tough to spot unless you're looking for it. Second, and this is crucial, we need to actively generate better data.
Truly equitable data.
Yes. Data that represents everyone, sex, race, gender, ethnicity. That's foundational to reducing bias at the source.
Makes sense. What else?
Third, continuous monitoring. We can't just launch these tools and walk away. We need to track them after deployment, focusing on actual clinical outcomes. Are they working fairly in the real world?
Not just in the lab.
Right. And finally, there's an ethical challenge. To analyze these systemic biases, we often need to collect data on race and ethnicity.
But that has to be done super carefully.
Absolutely. With ironclad confidentiality and security, it's a delicate balance.
So, recapping here, health data poverty has this really profound link to health disparities. It hammers home that data representation isn't just a technical detail.
Not at all.
It genuinely matters for how fair and effective these powerful AI tools are going to be.
It really does. And that leaves us with a pretty big question, doesn't it? Given how much AI is set to shape healthcare, what's our responsibility, as individuals, as a society?
Our responsibility to make sure that data is inclusive.
Yeah, to ensure it truly benefits everyone, especially those who are often left behind or most vulnerable. What role do we all play in that?